another episode where we fact-check coronavirus-related information. First up is a circular that's going viral on social media which claims that the Punjab Health Department in India has banned all poultry in the state in the wake of the coronavirus pandemic. This circular is false. It's fake, in fact. It had originated in Pakistan, where again it was being shared by the similar claims that the state over there, the government over there has banned all poultry farming. The Deputy Commissioner of Islamabad had taken to Twitter and called out this notification as fake news. In another viral claim, which is being attributed to the whistleblower Chinese doctor Li Wenliang, who was one of the first doctors to have alerted China about the coronavirus pandemic. This viral WhatsApp forward claims that Dr. Wenliang had apparently said that coffee is a cure for coronavirus, that serving coffee to patients can ward off the Covid-19 in them. The WhatsApp forward also claims that patients in China were being served coffee 3 times a day as a treatment for the coronavirus. The post claims that there are chemicals in coffee that can ward off the coronavirus. This, of course, is completely baseless, untrue, and fake news. Earlier, similar claims were being attributed to Li Wenliang. That time, it was being said that tea works wonders for COVID-19 and that tea is actually a cure for this very infectious and deadly disease. Both of these are absolutely fake news. There's no evidence that coffee or tea has any kind of chemical that can ward off COVID-19. And lastly, there's a post of a doctor that's going viral on social media, especially Facebook, where this doctor claims to be providing cures for coronavirus, remedies that can be practiced at home. There are no remedies that can be practiced at home for coronavirus to begin with. Although mild, patients are advised to stay at home and check their symptoms, but there is no cure as such for the coronavirus. Now let's take a deeper look at what this post is about. The post, it's being claimed, has been circulated by this doctor who claims to be Indian. However, on a deeper search on the internet, it appears this man is not an Indian doctor and he's not practicing at AIIMS as claimed by the post. He's in fact from Bangladesh. Now let's take a more detailed look at his suggestions. The doctor says that what should you do if you contract the coronavirus? And the first placard he's holding says that you should not go to the hospital. Now, although mild and asymptomatic patients are asked to stay at home and not be hospitalized, but that is not something you can decide for yourself. So the first thing you need to do is report to a doctor and tell him or her your symptoms and let the medical practitioner decide what kind of treatment or quarantine that you need. So, and besides that, the doctor goes on to give you a lot of medications and other kind of home treatments for coronavirus, which although they do not harm you in any way, but they are definitely not prescribed treatments of coronavirus. Remember, there is yet no drug that can really treat this disease specifically. There are various combinations that are being experimented with or that are being administered to patients, but definitely self-medication is not advised. If you have COVID-19 or if you have any symptoms of this disease, you must contact a medical practitioner, a doctor near you. Call them or visit a hospital. Do not self-medicate. Do not hide your conditions. These are all the updates today. Thanks for watching.